You've been told that masturbation after 60 is dangerous, shameful, or something you should have given up years ago. But what if the truth is the exact opposite? What if this simple, natural act could actually protect your penis, strengthen your erections, and even keep your prostate healthy? Because here's what most men don't realize. What happens to your body after 60 isn't just about age. It's about circulation, hormones, and the quiet loss of connection between your brain and your manhood. When that bond fades, so does your confidence, your vitality, your sense of being you. A leading urologist is revealing the science behind how to masturbate safely after 60, and when your body signals mean you need help. If you've noticed weaker erections, dryness, or fading sensitivity, don't ignore it. Stay with me, because what you'll learn could change how you age, how you perform, and how you feel as a man. You've been told that masturbation after 60 is dangerous, shameful, or something you should have given up years ago. But what if the truth is the exact opposite? What if this simple, natural act could actually protect your penis, strengthen your erections, and even keep your prostate healthy? Because here's what most men don't realize. What happens to your body after 60 isn't just about age. It's about circulation, hormones, and the quiet loss of connection between your brain and your manhood. When that bond fades, so does your confidence, your vitality, your sense of being you. A leading urologist is revealing the science behind how to masturbate safely after 60, and when your body's signals mean you need help. If you've noticed weaker erections, dryness, or fading sensitivity, don't ignore it. Stay with me, because what you'll learn could change how you age, how you perform, and how you feel as a man. You've been told that masturbation after 60 is dangerous, shameful, or something you should have given up years ago. But what if the truth is the exact opposite? What if this simple, natural act could actually protect your penis, strengthen your erections, and even keep your prostate healthy? Because here's what most men don't realize. What happens to your body after 60 isn't just about age. It's about circulation, hormones, and the quiet loss of connection between your brain and your manhood. When that bond fades, so does your confidence, your vitality, your sense of being you. A leading urologist is revealing the science behind how to masturbate safely after 60, and when your body signals mean you need help. If you've noticed weaker erections, dryness, or fading sensitivity, don't ignore it. Stay with me, because what you'll learn could change how you age, how you perform, and how you feel as a man. Meet John. He's 67, a retired firefighter, the kind of man who still chops his own wood, fixes what's broken, and never asks for help. But lately, something's been breaking inside him. His erections faded, his desire disappeared. And though no one could see it, his confidence took a quiet beating. He told himself it was normal, that this is just what happens to men after 60. Out of embarrassment, he started avoiding intimacy altogether. And when he felt the urge to touch himself, he stopped, convinced that masturbation was for younger men, that it would somehow make things worse. When John finally sat across from me in my office, I could see the shame written on his face before he even spoke. "I feel like I'm cheating nature," he said. "Isn't masturbation after 60 bad for the prostate?" I'm Dr. Catherine Rotker, a men's health specialist and urologist with over 30 years of experience helping men navigate this exact struggle. And what I told John that day shocked him, just like it surprises most men I treat. The truth is, moderate masturbation can actually protect your prostate and help maintain strong erections. It's not something to be ashamed of. It's something your body needs. Research from Harvard and the Journal of Sexual Medicine shows that regular ejaculation, whether through sex or masturbation, helps flush out inflammatory compounds that build up inside the prostate. It keeps the tissue healthy and reduces congestion. In fact, men who ejaculate 21 times or more per month have up to a 33% lower risk of prostate cancer compared to those who don't. What John thought was dirty was actually his body's natural way of staying functional. When you stop releasing, blood stagnates in the pelvic region. Hormonal rhythm slows down. The vascular system that feeds your penis weakens, and that's when erections fade. I told John, your penis isn't just an organ, it's a reflection of your overall vascular health. It depends on oxygen, blood flow, and nerve communication. And when you neglect it, the body responds with silence. So we worked on something new, mindful, safer self-stimulation. He used lubricant to avoid friction. He slowed down, breathed deeper, and focused on pleasure rather than release. He treated his body like a system, not a problem. Within a few weeks, his morning erections started coming back, not because of medication, but because his blood flow and confidence began to return. His energy changed, his posture changed. He started feeling like himself again. The hidden truth is this: you don't lose your manhood after 60. You lose it when you stop listening to your body. Your erections, your desire, your vitality, they're not gone. They're just waiting for you to stop feeling ashamed of being a man. There's a silent enemy working inside your body after 60, and most men don't even know it's there. It's called endothelial dysfunction, the slow breakdown of the inner lining of your blood vessels, the endothelium. That lining is what releases nitric oxide, the gas that tells your arteries to relax so blood can flow freely. When it weakens, blood doesn't reach where it needs to, including your penis. Erections become softer, slower, less reliable. And it doesn't stop there. This same process affects your brain, your heart, and your mood. Poor circulation means poor oxygenation. Without oxygen, your cells starve, your energy fades, your focus drifts. You stop feeling like yourself. Add in cortisol, the stress hormone, and you've got the perfect storm: tight arteries, exhausted nerves, and crashing testosterone. The longer that cycle runs, the harder it becomes to feel pleasure or perform naturally. But here's what few men understand: shame feeds this enemy. When you stop talking about masturbation or treat it like something dirty, you miss one of your most natural ways to fight back. When done safely, masturbation isn't self-indulgence, it's circulation therapy. Every erection is a pulse of oxygen-rich blood into the smallest vessels of your body. Every release helps clear old, stagnant fluid from your prostate. But when you do it the wrong way, rushed, dry, or with too much pressure, you're reinforcing that same damage. The pelvic muscles tighten, the blood vessels constrict. The brain associates pleasure with tension, not relaxation. Over time, your erections depend on overstimulation, and your body forgets what natural arousal feels like. But when you slow down, breathe deeply, and use proper lubrication, everything changes. You shift your body from a stress response into a healing one. Nitric oxide begins to rise again. Blood flows freely. Cortisol drops. A Mayo Clinic review found that regular, gentle sexual stimulation improves vascular elasticity, the ability of your arteries to expand, and increases testosterone sensitivity by over 20% in older men. That means your penis stays responsive, your blood vessels stay flexible, and your brain stays connected to desire. So the real enemy isn't masturbation. It's the way you do it, and the beliefs you've been carrying about it your whole life. When you stop seeing it as shameful and start seeing it as part of your body's health, you turn that silent enemy into your greatest ally. You reclaim control over your blood flow, your erections, and your confidence, not through pills, but through understanding. So how do you masturbate safely after 60? It's not about how often you do it, it's about how you do it. Your body has changed. Your skin is thinner, your circulation slower, your nerves more sensitive to pressure. That means what once felt normal can now cause irritation, inflammation, or even damage. But done correctly, masturbation becomes one of the best ways to protect your erections, your prostate, and your overall vitality. Step 1. Warm up your circulation. Before touching yourself, take just 5 minutes to get blood moving. Walk around the room, stretch your hips, or do gentle pelvic floor squeezes, what doctors call Kegels. According to NIH research, these simple movements can boost nitric oxide levels by up to 25%, priming your arteries for better blood flow to your penis. When blood moves freely, your erections respond faster and stay firmer. Step 2. Always use lubrication. Dry friction is the #1 cause of microtears and sensitivity loss in the penis. You might not feel it immediately, but over time, those tiny injuries reduce responsiveness and create scar tissue. Use a natural water-based lubricant, something as simple as aloe vera gel or glycerin-free lube. It mimics your body's natural arousal fluids and protects the delicate endothelial lining that keeps erections strong. Step 3. Breathe and slow down. The goal isn't speed, it's connection. When you rush, you trigger cortisol, the same hormone that constricts blood vessels and kills nitric oxide. But when you slow your breathing, you calm your nervous system. You let oxygen flow, your brain releases dopamine and oxytocin, the same hormones that build intimacy during sex. Those chemicals tell your body this is safe, this is good, and they train your erections to last longer without strain. Step 4. Hydrate and restore. After ejaculation, your body loses minerals essential for male health, especially zinc and selenium, both crucial for testosterone and sperm quality. Eat 1 Brazil nut for selenium, or a handful of pumpkin seeds for zinc. Then drink a full glass of water. Your body isn't just releasing, it's rebalancing. When you follow these steps, you're not just masturbating, you're performing vascular therapy for your penis. You're keeping blood vessels elastic, nerves awake, and testosterone active. Harvard researchers found that men who maintain regular, safe sexual activity, even solo, show better cardiovascular health and lower rates of erectile decline. So every careful touch, every breath, every moment of awareness isn't wasted time. It's medicine. It's strength training for the most vital muscle of your masculinity. When you learn to do it safely, masturbation after 60 stops being a secret. It becomes self-care, the kind that keeps you alive, confident, and connected to the man you've always been. Here's what happens when you start following these steps the right way. During the first week, something subtle but powerful begins to shift. You start feeling more connected to your body. Your penis feels alive again, not just reactive, but responsive. Morning erections, even brief ones, begin to return. It's your body's way of saying, I remember this. The improved circulation and release of nitric oxide begin to wake up tissues that have been dormant for years. You feel warmth where there used to be silence. By the second week, changes become noticeable. Blood flow improves and you start sensing more firmness, more control, more confidence. According to Harvard Men's Health Watch, endothelial function, that's the health of your blood vessel lining, can show measurable improvement in just 14 days of consistent vascular activity. That means every time you practice safe, mindful masturbation, you're retraining your arteries to open up again. You're rebuilding the very pathways that carry blood into your penis and your brain. By the 3rd or 4th week, you begin to experience spontaneous erections again. You wake up to them. You feel the strength in your pelvic muscles returning. The sensitivity that had faded starts to come back. Not in a jarring way, but as a quiet reminder that your body still works when treated with respect. Your prostate begins to feel lighter, less congested. That full or heavy feeling many men describe starts to ease, because regular ejaculation helps clear built-up fluid and reduces inflammation. Studies in the Journal of Urology show that men who ejaculate consistently have healthier prostate markers and lower discomfort over time. Around this same point, your hormones begin to balance. Testosterone levels rise naturally as blood flow improves and cortisol, your stress hormone, drops. You notice it in small ways first. More motivation in the morning, steadier focus during the day, a quiet but unmistakable sense of vitality. By 60 days, something remarkable happens. Safe, mindful masturbation becomes more than a habit. It becomes part of your health routine. You're not just chasing pleasure anymore. You're maintaining the system that makes intimacy possible. Men who treat this practice as maintenance, not secrecy, see the most lasting results. You're literally training your penis to stay oxygenated, strong, and responsive. You're sending life back into the arteries that feed your erections. And unlike a blue pill, which only forces a temporary response, this builds endurance from the inside out. You're healing the root cause: circulation, confidence, connection. After 60 days, it's no longer about fixing something broken. It's about keeping something sacred alive. Your erections, your energy, your masculinity, they're not gone. They were waiting for you to start listening again. The biggest mistake men make after 60 isn't masturbating, it's hiding it. When you treat it like something shameful, you stop listening to what your body is trying to tell you. That silence is dangerous. Pain, numbness, delayed ejaculation, or the total loss of erections are not just part of getting older. They're warning signs, signals of something deeper. It could be penile neuropathy, where nerves lose sensitivity, or circulatory damage, where blood can't reach your penis properly. Sometimes it's low testosterone, which affects nearly 40% of men over 60, according to the NIH. Ignoring these changes doesn't protect your pride, it delays your healing. When you notice them, see a urologist, not to be judged, but to be helped. And never use tight grips, extreme pressure, or constant porn stimulation. These can desensitize your penis and confuse your brain's natural arousal response. You're not proving your manhood by pushing harder. You're preserving it by respecting your limits, by choosing awareness over denial. Your body is wiser than you think. When you learn how to masturbate safely after 60, you're not indulging, you're investing in yourself. You're protecting your penis, your prostate, and your erections. You're keeping the fire of your masculinity alive, not through pills or pretense, but through awareness and care. Every man deserves that power, that peace, and that pride. If this message spoke to you, share it with a friend who's been struggling in silence. Let him know he's not alone. Like this video, subscribe, and comment the word strength below to let me know you're reclaiming yours. Because real manhood isn't about denial. It's about taking your health back, one choice at a time.